breast cancer, I think there is a lot of stigma and shyness is still there. Lot many inhibitions in talking to the doctor. So I think consider your body as a temple, and every part is important. Talk to your doctor whenever you find the smallest abnormality of it, and talk to family. So socially also, if we kind of get aware, that would be great. Whenever we give we take a homeopathic case, and usually a case of a chronic case would be taking around 60 to 90 minutes. And our patient is not usually conditioned to speak this. When they come for first time, they are not conditioned to hear such questions: how much you eat, how much water you drink, how you feel. So I have to tell my few patients that give it a thought. And no need to answer it immediately. Give it a thought, then come back. Okay? And when I advise acupressure or yoga and diet, because these are also part and parcel of our lifestyle, we have to improve that. And homeopathic cure becomes a quick thing with this. Yoga is thousands of years old, and certainly helps in hasten the recovery. So, if you ask me, I have seen patients recovering from cancer as early as in 3 months from homeopathy. And if you actually ask me about longevity, so I know few patients who got cured of breast cancer through homeopathy, and it is a few patients, 18 years, 20 years, they are still there, alive, no recurrence. That's a great thing.
Hello everyone, I welcome you on the platform of Sugar Shell Brands. Today we have come with yet another interesting and important topic, that is how homeopathy treatment can cure cancer. So let's find out from homeopathic expert herself, Dr. Shubhangi. She is a veteran in the field of homeopathy, having more than 25 years of experience, and also she has helped 36,000 patients to live better and healthier life. She is also a certified Ashtanga Yoga teacher and in acupressure and energy healing. Recently, during pandemic, she cured more than 4,000 patients, combat COVID and post-COVID successfully. Dr. Shubhangi has received many awards for her outstanding work and popularity. Her clinic, named Saksham Homoeopathic Clinic, are keen to providing their patient holistic treatment, that is homeopathic treatment along with yoga, diet, nutrition, acupressure, and importance of healthy habit as per need of the case. Here, cancer patients are also get treatment. Hello ma'am, I welcome you on the platform of Sugar.
Thank you for having me, Sushmita.
So let's begin with the discussion. So ma'am, as our viewers mostly under the age of 20 plus, I'd like to understand that how you have been treating many cancer patients including breast cancer. So how homeopathy helps in combat cancer treatment, especially breast cancer?
In homeopathy, whatever case is, we treat it with the totality of symptoms and individualistic approach. And as homeopathy would always treat every case, it is like why this has happened. So that why is most important, and the treatment would go there. So usually in our cases, we ask whole history of life. So if a patient of 50 years, and I might be asking what happened at 10 years, and he would say it is very, very old. And I would ask him, it is in the same birth, no? So that is important for him. It's like this. And even antenatal symptoms, if we get, many times we get flu from that. So homeopathy is deep, and it works on why, and that's why it helps. So that immunity improves, and we help in whether it's a cancer or a diabetes or a hypertension. And for example, these days you must have seen that diabetes and hypertension are also an increased risk factors. But why? So we consider in fever patient that if my patient is having any symptom, so what I would like to say is there are all those small diseases are also precursor of cancer. What I have found is, see, simple. When you get a fever, your macrophages secrete a pro-inflammatory thing like TNF. TNF is tumor necrosis factor. Okay, this TNF in animals have found to kill the tumor, and it has been named TNF in 1970. But now scientists are finding that TNF is actually leading to cancers also. So they are thinking to change the name. But what happens is, actually TNF is working properly. But when you are giving chemical medicines during fever, you are actually confusing your TNF and modifying its action. So what I have seen is, a patient, if taking for 15 to 20 years, if somebody is taking homeopathic treatment or so, I have never seen them getting cancers. So somehow we feel that if you are taking proper treatment in every disease, every smallest thing, if you treat it with homeopathy, then you may not be getting cancer. If you really want, I would like to add one more point. Like when TNF is modified, it also goes for dyslipidemia. जब TNF थोड़ा बॉडी में बढ़ रहा है, ट्यूमर नेक्रोसिंग फैक्टर, तो आपको पता चलेगा कि आपका कोलेस्ट्रॉल मतलब लिपिड्स आपके इधर-उधर हो रहे हैं. They are getting abnormal readings and insulin resistance. You may get sugar, you may get blood sugar elevated, तो आपको डायबिटीज हो रहा है. लेकिन क्या जब भी आपको डायबिटीज या बीपी होता है, तो क्या आपके डॉक्टर ने ये सोचा है कि ये क्यों हुआ? अगर आपने भी ये सोचा है तो अच्छी बात है, वरना यूजुअली ये होता है, यू स्टार्ट ट्रीटिंग इट. आप शुगर कम कर रहे हैं और आप लिपिड्स कम कर रहे हैं, आप स्टैटिन दे रहे हैं, जबकि सोचना ये है कि व्हाई. इफ व्हाई इज देयर, देन आई थिंक दैट इज होम्योपैथी.
Interesting. So ma'am, what is the case with specific to breast cancer, if you can, like in terms of women related cases, what are lifestyle issues maybe, or anything on that note, that how a woman in terms of prevention, if I say, or in terms of hormonal changes, lots of women goes with lots of different hormonal changes, lifestyle changes. So what do you want to suggest on that?
Absolutely. See, I would certainly suggest that first thing is women start taking care of themselves. There are still many women who put themselves last. Okay, and if there is time, they might take care of themselves too. So, first thing, take care of yourself, because if you are healthy, your family is healthy. If you are happy, your family is happier. So, take care of yourself. Second thing, in lifestyle, I would say using as less chemicals, whether it is in cosmetics or it is coming out of your refrigerator. Okay, so less of the processed food, less of the packaged things, because every packaged thing could have preservatives in it, and they may not be very safe to your health. So taking care of that, and taking care of cleaning your vegetables and fruits is also a vital point. If the last wash is done with baking soda,
Okay.
Then you are reducing your pesticide by almost 90%. So do take care of such things. These things will matter into the lifestyle. Next thing is also about conflicts and suppressions of emotions. Homeopathically, we do give major weightage to this. So as women will start taking care of themselves and getting courageous and bold to express, I think the load of such diseases would also reduce. And the last thing is related to your first question, that if you start treating all small diseases homeopathically or with medicine which is based on nature's law, then it would be great.
That's a very important point you mentioned.
The apparels, what you are using, the clothes, they are also very important. Many times in pregnancy and all that, ladies are not really taking great care of themselves, and they might be wearing the same clothes for a long time. So I think they can take care for themselves. I think in last few years, many women are much more aware of these things, but at the same time, I think big percentage is still lacking in this.
So, ma'am, what you will suggest in terms of awareness and prevention as well? I mean, you covered a lot points in terms of lifestyle, but in terms of awareness also, like there are lots of women who just are not aware on such kind of discussions, or they probably miss out in their daily routine work, and that awareness or focus kind of miss out. So what do you like to suggest or put forward in terms of simple words, if I say that way?
See, if you really specifically speak about breast cancer, I think there is lot of stigma and shyness is still there. Many inhibitions in talking to the doctor. So I think consider your body as a temple, and every part is important. Talk to your doctor whenever you find the smallest abnormality of it, and talk to family. And I think socially also, if we kind of get aware, that would be great. I think I certainly appreciate many men who are talking about such topics, and that certainly helps our society to grow.
True, right, ma'am. There are actually, in fact, I come to know that from doctors that even 1% of the men population can also get breast cancer. That is also the case. So even it's not only about the women-centric problem, but it can happen for to men also. So it should be a overall awareness. So ma'am, moving on with respect to your main focus where you treat is holistic approach. So I like to understand how other aspects like nutrition, yoga, and acupressure, all this works for such patients. And I also like to understand with respect to emotional well-being. So what do you want to say about that?
Sushmita, whenever we give we take a homeopathic case, and usually a case of a chronic case would be taking around 60 to 90 minutes. And our patient is not usually conditioned to speak this. When they come for first time, they are not conditioned to hear such questions. How much you eat, how much water you drink, how you feel. So many times it's a great catharsis. Few times it's also confusion that they haven't thought of. So I have to tell my few patients that give it a thought. And no need to answer it immediately. Give it a thought, then come back. Okay? And this is a great catharsis. At times it so happens that partly they start getting cured from where it's, and then this homeopathic part comes. And when I advise acupressure or yoga and diet and nutrition, because these are also part and parcel of our lifestyle, we have to improve that. And homeopathic cure becomes a quick thing with this. Yoga is thousands of years old, and it certainly helps in hasten the recovery. So if you ask me, I have seen patients recovering from cancer as early as in 3 months from homeopathy. And as many investigations we do keep regularly doing now, no recurrences. And if you actually ask me about longevity, so I know few patients who got cured of breast cancer through homeopathy, and it is a few patients, 18 years, 20 years, they are still there, alive, no recurrence. That's a great thing.
Wow, interesting. So ma'am, throw some light on emotional well-being when patients go through in such treatment. So it's not only individual but overall the family also who is dealing with this scenario. So how they how that we can help them in terms of emotional well-being, mental well-being as well.
So Sushmita, are you asking about the emotional well-being after the diagnosis of cancer?
Yeah, so during the whole journey, and once they are treated well, and after that also, so how that process goes with your treatment?
See, first thing is, what I would like to suggest patient is, don't be petrified. Don't be petrified with the diagnosis. Let me tell you, some 20 years back, many patients would actually don't know what their diagnosis is. Okay? Now that things are becoming more open and all that, most of the patients know about their diagnosis. But 20 years back, I remember children would lie that their parents do not get to know that they are diagnosed with cancer. And let me tell you, I have so many cured cancer cases and early those times. Even now, we try to do that. See, because cancer is such a stigma or such a fear in people that they somehow start thinking that I'm going to die. And whatever other disciplines think of this, I certainly feel that this is one of the progressing factors in the cancer. So, treat it as any other disease as such. Okay, any chronic disease bothers you a lot. Even simple, even whether it's a rheumatoid arthritis or some other disease, you do trouble like that. So start with it, and don't show that fear in your eyes. Okay, family should remember, because that also kills someone. So we can start with this, and then have that fight it all attitude. Okay, that attitude helps. I know patients who have been given really few months, 2 months, 3 months, and they have told that I'm not going to die for 10 years, please help me. I'm not going to die for anywhere 10 years, but you can help me in symptoms. And I have seen patients living for 15 years, 20 years. 15 years, 20 years after this kind of diagnosis. These people are very much there, meet me, and you cannot really imagine on looking at them that they must be called cancer survivors. So this can happen. This can really, really happen. And this may be called as miracle by the patient, but it is not. It's highly scientific and it is possible.
Wonderful, ma'am. I mean, that is really a booster for all the audience here who is listening to us, that yes, homeopathy treatment is definitely a great cure for cancer, and of course we all now with time we are coming to know that cancer is not a death sentence. People are living life post surgeries and cancer treatments. And so ma'am, moving ahead, I like to ask.
I would really like to mention here, I'm sorry to interrupt you.
Yes, ma'am.
Please look for an expert in homeopathy. Okay. What so happens, there are many patients who tell me when they come to me, they say, we have also tried homeopathy so many years back or something. So when I ask them that, how you tried it? So they said, we went to a doctor, we took homeopathy, it didn't help us. And so we stopped. So getting treated from one doctor for 1 month may not be trying homeopathy. Okay? What you usually do in any other scenario, if one doctor cannot help you, if one person can't help you in any business, anything, you go to the next one at least. Okay, you go to the expert. If you go to the expert, treat yourself properly, at least 3 months of treatment, or at least see if it is an acute case, you can get results within few minutes or few hours on the same day. But if it is a chronic patient and you have really suppressed your disease a lot with different kind of medication, you may have to wait. Depends on the progress of disease, stage of disease, and the level of medication you have taken. So that point is highly important, that you go for an expert. I would like to request.
Right. And it's also
experienced.
Right. And ma'am, also it depends on case to case, definitely. So moving ahead, ma'am, another point which is very much talked about is about the cost of the treatment. So how this particular homeopathy treatment helps for patients who are coming from moderate income background.
I think most of the time your cancer treatment with homeopathy may be equivalent to your 1 or 2 days of stay in the hospital.
Wow.
Okay.
That is a good way of
it's not.
Right, ma'am. So, ma'am, as we all understand that cancer is all about chemotherapies, treatments in allopathy section. So, how this is treated, this chemotherapy part, how it is treated in homeopathy case, homeopathy treatment?
See, Sushmita, chemotherapy is allopathic medication,
yes,
and it is given in particular way for a particular disease. In homeopathy, we have it is very person oriented, and it is the same sweet pills for any other disease we give, and it would be similar. There could be few mother tinctures, few liquid medications also added if need be. It's the same, and if patient does come to us with much pathology progressed, then yes, then we give organ-specific remedies to treat it or palliate it. Okay, there are different stages where we can cure it and we can palliate it. So we may palliate it in the progressive disease, progressive stages of disease.
Understood. So, ma'am, okay. So now let's move to the prevention part of it. Last time when I was talking to you, you were mentioning about mammography versus sonography or ultrasound. So if you can throw some light on that, that was an interesting point you were making on that discussion. So if you would like to talk more about that, how it is.
I would point out that many ultrasonologists also prefer and are very good. They are extremely efficient to find your cancer in ultrasound itself. So, mammogram done very regularly and repeatedly also pose a risk of cancer.
Okay.
So, I would like to suggest that patients repeatedly can go to an ultrasonologist and get an ultrasound done. Mammogram can be done if there is any doubt of it and your radiologist want to confirm it, or your gynecologist really want to confirm it, your doctor wants to confirm it, then you can go to such thing. But doing repeatedly mammogram, or actually when it is not advised by the doctor, but if you're getting done it on your own suggestion, your self-suggestion, I think that is not at all advisable. Ultrasound breast is it's a great investigation in terms of diagnosing cancers. So, other lifestyle changes, as we have already mentioned and discussed about those things, we can avoid, and also those factors which increase the obesity, somehow they also have a relation with TNF, and increased obesity or anything which increases fat or your weight can also increase the lump or the size of it. So you can always take care of that. So staying fit, exercising can play a major role in treatment of any disease and cancer.
So, ma'am, it also says that if somebody is there in your genetic, it is kind of a genetic disease as well. cancer. So what do you like to suggest on that, that if somebody having a history in his family, her family, then should that lady go for all this ultrasound or mammographic
it would be great. It would be great if you keep a checkup. Okay? But
so
there are certain things which can be taken care of.
Okay.
I had few patients who had a very strong history of cancer. Okay? And so they started homeopathy early on.
Oh, okay.
Those people who couldn't start or they did get a cancer, but these ladies who started with homeopathy or with certain members of family, few of them didn't get it. If few of them did get it, they got it cured very early, within just few months or so. And apart from this, I would just suggest that they turned vegan. If you stop eating meat and animal products, if you get to know that you have a very strong history of cancer, I think that helps. I have few patients who have done this.
It's 13 hours.
That's a very good suggestion, ma'am. So now let's talk. Okay, another question I have in this regard, that what is the ideal age for female to go for such checks in terms of post 40? Generally, I heard that after 40 one should go checking herself with respect to any sort of cancer is there or not, all that way. So what do you like to comment on that?
See, breast examination can be done early on, okay, at any age, and lumps are usually painless, so you shouldn't wait for the pain to occur. Okay? Painless tumors also, if you get checked by your doctor, that is a great thing. Apart from this, whenever you find that your menstrual cycle is irregular, then you need to check it on early on, that whether you have a hormonal imbalance, why this is happening. So if it's a homeopathy, why is very important. That's what I say. We don't go and directly treat the problem. You have come with a problem and I would start treating problem. I would go in a why. And if every doctor goes into that why, then I think cancer cases can be really, really reduced to much, much less number, because this is very painful. Every year, this data is getting
is increasing.
worst of it. Okay, devastating numbers. Okay, so we need to really, really work on this and checking early, around 35 years.
Okay.
And ladies can also, if they start seeing any change into their weight, their appetite, their sleep patterns, and their hormone pattern, then they must get investigation. And I think they should start on this holistic homeopathic treatment. I think that should really, really help them.
Wonderful. So thank you, ma'am. That is really important to know. And moving ahead at the last section of the discussion, I just wanted to ask, as you just now you mentioned about good clothing is important. So as Sugar Shell brands work in inner garment section, so what do you like to suggest, that how it is important to choose the right inner garments for cancer patients as well as normal people, women, I will say. So what are your comments on that?
So dear Sushmita, I must appreciate when I got to know about you and the work you are doing. I have a deep respect for this and the way you are working. And I have heard of good reviews from people for your garment. And as you are also providing these garments for even normal people, so I would say they must try it. Anything which is made for you, or while it is taken care of health, I think that's great. Your biomedical background would help it a lot.
Thank you.
And I think that is a great starting to start the awareness, social awareness, and the awareness in females about themselves. Okay, because somehow I think still this is a much neglected area in ladies, and the way you speak on social platforms, I appreciate it. And you must be bringing out many ladies to speak about it, think about it, and I would recommend people to use such things which are made for them and which are made thinking not just aesthetic thing, but where your health and aesthetic meet. I think that's a great combination.
Thank you, ma'am. Thank you for all the appreciation. And moving ahead, I like to tell all my viewers that Madam Shubhangi is also coming up with her YouTube channel where she loves to explain about her homeopathic treatments and other health related things. So, ma'am, would you like to share that thoughts here?
Dear Sushmita, I'm also I'm a homeopath, and at the same time, I'm also an immunity activist. Okay, I really want everyone to have great immunity, and I'm working on that. There are many things we are doing at the moment against ourselves. Okay, we are going against nature and somehow harming our own health. So this channel would be helping people to improve their lifestyle. Today, I will be telling them about diseases, and also most important is how they can improve their immune system and improve immunity in general.
Wow, that will be help.
For just FYI, I would like to say that during COVID, I got so I treat patients worldwide through telecommunications, telemedicine. And I have got so many patients telling me that now we get to know about immunity, but you have told us years back. You always explained us about immunity, and we are in a great shape, and maybe that's why we didn't really get COVID, or even if we got it, it was a mild one, and they could really come out very early and easy.
That is really a success
to take care of immunity.
I really wish that this YouTube helps everybody listening to us, that it will be help in terms of various treatments, immunity related issues, and life, anything related to life issues, I mean health issues. So thank you, ma'am. Thank you for doing this with me, taking so much time for us and doing this. So thank you once again. Talk more about immunity for the next discussion. So thank you, ma'am.
Okay, it was a pleasure. I love this conversation, Sushmita. Thank you.
Thank you, ma'am. Thank you, ma'am.